Did you know that nearly 40% of Americans are obese? That's more than 1/3 of our population. Obesity is linked to increased mortality rates and risk of chronic disease. With obesity rates on the rise, it is important to examine some weight loss methods. One increasingly popular method is a ketogenic diet, or keto diet for short. By following the ketogenic diet, one can experience great benefits to their health and begin their journey to a healthier lifestyle. Today, I would like to discuss what the ketogenic diet is, how it can benefit your health, as well as examine some possible drawbacks and side effects that can come from following it. Now, in order to reap the benefits of the keto diet, we must know what it is and how to follow it. So what is the keto diet? Vicki Stein, a health writer for the University of California, San Francisco, explains the goal of the keto diet is to bring carbohydrates down to less than 5% of a person's daily caloric intake. In a typical diet, carbs account for as much as 45 to 65% of a person's daily caloric intake. The keto diet replaces the calories lost through carbs with fat. The body tends to use carbs as its primary energy source. However, when following the keto diet, the body goes into a state called ketosis, wherein it turns stored fat into its primary energy source. In order to reduce carbohydrate intake, individuals following the keto diet must abstain from grains, legumes, starchy vegetables, and most fruits, except for a small amount of berries and practically all sweets. This means that for one following the keto diet, they cannot eat things such as bread, cereal, potatoes, and bananas, to name just a few things. To replace the lost calories, keto dieters must consume more meats, dairy products, and leafy green or colorful vegetables. A person following the keto diet might eat things such as yogurt, lettuce and avocados, eggs, and meats, such as ground beef and sausage. To many, this sort of menu is not consistent with the types of food in most diet plans. However, there have been documented benefits to following the keto diet. The keto diet has received great amounts of attention and grown in popularity in recent years. This is due to the many testimonies and experiences shared by celebrities, social media influencers, and food bloggers concerning its positive impact it can have upon one's health. Perhaps the reason the keto diet is most used is for weight loss. In her article, 8 Fad Diets That Actually Work, Franziska Spritzler, a writer for Healthline.com's nutrition page, cited a study wherein obese adults who participated in the keto diet dropped 27.5 pounds on average over the course of 2 years. While not all may experience such drastic results, most report seeing results on the scale within a matter of a few weeks. The benefits go beyond weight though. Many following the diet have reported feeling more energized, getting more sleep, and generally feeling happier. Beyond just looking and feeling better, the keto diet has medical benefits too. It was originally developed to treat epilepsy in patients, especially small children, who were resistant to their drug-based medications. Dr. Marcelo Campos also mentioned the possible impact for people struggling from type 2 diabetes and those struggling with high cholesterol. In his article, The Ketogenic Diet is the ultimate low-carb diet good for you, written for Harvard Health. Because of its neuroprotective abilities, the keto diet may even be used to treat an array of neurological disorders, as more studies are done. When followed carefully and closely, there are undeniable benefits to following the keto diet. However, there is also the possibility of experiencing some negative side effects. One of the most common side effects that occurs when a person first begins the diet is talked about in an article by Vera Tweed, The Ultimate Keto Diet, written for Better Nutrition Magazine's March 2019 issue. Ms. Tweed describes what occurs by saying, by reducing carbohydrates, a keto diet dramatically reduces the amount of blood glucose available as fuel, and it takes a while for fat burning and ketone production to ramp up as the alternative fuel. During this transition period, keto flu with symptoms such as fatigue and brain fog can make it difficult to stick with the diet. Another drawback of the keto diet is sustainability. Though many have proven that it is possible to live off this low-carb diet, it is not realistic for most. As a result, many following the diet may do so for a few months. They may lose the weight that they are trying to and then relapse back into old eating habits. If one is not careful, this cycle of dieting, losing the weight and then relapsing and gaining it back, can result in yo-yo dieting, which can lead to increased mortality. Perhaps the most important thing to consider before starting a new diet is to seek counsel from your doctor. Your doctor is able to provide personal advice and support to help you meet your medical needs. In conclusion, the keto diet has become very popular in the past few years. By following this low-carb, high-fat diet, individuals have experienced health benefits, including losing weight and generally feeling better. However, remember, the keto diet is not necessarily a one-size-fits-all solution to your health problems. Some may not find that it is suited to their needs. However, as a whole, most can experience great benefits to their health and begin their journey to a healthier lifestyle by starting the keto diet. When considering what you can do to lose that extra weight, you may consider looking into the keto diet to see if it meets your needs.